Hi everyone, my name is Dr. Aaron Luby, and I'm the Director of Clinical Training at the Miami University Clinical Psychology Doctoral Program. I want to welcome you to our virtual interview day. This is the first of 4 short videos that will give you a little bit more information about our program. Let's go ahead and start by talking a little bit about our philosophy and our curriculum. Our program is one of 13 doctoral programs at the Graduate College at Miami University. And psychology as a major is one of the largest in the College of Arts and Sciences. So as you can see here, Miami University has a large focus on undergraduate education. So you might be asking yourself, why doctoral work then at Miami University? Well, because we're one of only 13 doctoral programs in the graduate school, what our university calls selective excellence in graduate education. What this allows for is a lot of resources to be sent our way to promote the doctoral program in clinical psychology. Our doctoral program at Miami actually consists of 3 interrelated areas: the clinical psychology program to which you've applied, the social program, as well as what we call brain, cognitive, and developmental. And together we have roughly about 60 to 70 graduate students across these 3 areas at any one time, with about 35 or so of those being clinical students. Within the clinical psychology program, our philosophy is a scientist practitioner model, and we take a very strong developmental perspective as well as prioritize evidence-based practice. Another feature of our program that I think is excellent is that we use an ecological model, and this comes up both in our training for clinical intervention, including intervention with individuals, parents, families that are nested within communities, but also thinking about the diversity of research methods that we engage in here. You might hear some kind of cutesy little sayings like from cell to society or from neuron to neighborhood. And I think across practitioners, across researchers in our program, we have evidence of individuals looking at things at the biological level all the way up to sort of community engagement and macro system types of influences on psychopathology and treatment of psychopathology. Our program is APA accredited, as you're likely aware, and just this past year we received 10 years of reaccreditation, so we'll be up for another site visit in around 2030. In addition to the ecological framework that guides our intervention and our research efforts, our department as a whole and our program specifically are really driven by a value of diversity, inclusion, equity, and justice. What you see on this screen here is our department's diversity and inclusion statement. I won't read the whole thing to you. You can read it here. You can also see it on our website. But I think within the clinical program in particular, but also our department as a whole, we really value diversity and inclusion. We're trying to do work that increases equity and that also has a social justice perspective. We think about identities that we bring to the room, that our clients bring, that those participants who participate in our research bring, and how those intersecting identities influence our work, both clinically and research-wise. So we're guided by our values of diversity, inclusion, justice, and equity in the work that we do. Do we have room to grow? Sure, we're all along our path of cultural humility and cultural competence and how we grow in those 2 areas. But I think as a whole, our clinical area, both faculty, students, the staff, are really devoted to improving the world through the lens of equity and inclusion as well as justice. So who are our program? As you can see here, we have a highly engaged faculty. There are 7 faculty members who are tenure track faculty, and there's a separate video that introduces you to all of us. I really want to point out 2 individuals in particular. So Dr. Aldajani and Dr. Sulyard are 2 new faculty members who will be joining us next year. We're super excited about the work that they do, thinking about things like suicidal ideation in connection with eating pathology, as well as LGBTQ mental health in connection to eating pathology. So we're really excited to have those folks join us next year. In addition to our tenure track faculty that you see on the left-hand side who serve as primary research mentors for students in our program, there are 3 individuals who are what we call clinical faculty. These individuals include our new clinic director, Dr. Evans Tobin, who's been with us for about 2 years now, as well as Dr. Green and Dr. Wiese, who are both clinical faculty who do a lot of the supervision of students in our program as they're seeing clients, both in our clinic as well as out in the community in some of our school-based mental health positions as well. Now, one of the individuals you won't see in that video, but who is an affiliated clinical faculty, is Dr. Cricket Meehan. Dr. Meehan is the director of the Center for School-Based Mental Health, which is housed within the Department of Psychology. Her work is primarily focused on bringing mental health into the schools in terms of both prevention and intervention. And recently, she and her team were awarded a $6 million grant from the Ohio Department of Mental Health in the state of Ohio, which is actually one of the largest grants that Miami University has received. So a lot of our students who are interested in working in schools or working with communities have had opportunities to work with Dr. Meehan's treatment team in the Center for School-Based Mental Health. Let's shift gears a little bit and talk about our curriculum. What you see on this slide is an overview of how the curriculum is broken down across the 6 years that students are in our program. As you can see, in years 1 and 2, there's a lot more coursework, didactic coursework. Our students are taking classes, and that peters out across years 3 and 4. In the middle, you'll see that our official kind of start of clinical work happens in year 2 when students are first assigned clients in our in-house psychology clinic. Now, some of our students are helping out with the Incredible Years program. That's a social skills group in the schools, but formal clinical work typically starts for most individuals in years 2. And our students are seeing clients or doing assessments either in our clinic or out in the community in years 2, 3, 4, and 5. And then, of course, on year 6 is clinical predoctoral internship. In terms of research, we have 3 milestone experiences in addition to other ongoing research that students are doing outside of these milestones. So primarily in years 1 and 2, students are working on the master's thesis. Year 3 is the comprehensive exam. And then years 4, 5, and 6, students are working on their dissertation. A lot of our students finish up dissertation before they go on internship, but I would still say about 50% of our students are finishing up the dissertation while on internship. We'll talk a little bit more specifically about clinical work and research in additional videos. I just want to take us through a little bit what our coursework looks like. In general, you can expect a developmental, sequenced, and graded experience in our program. In year 1, you're taking courses in things like lifespan developmental psychopathology. What do disorders look like? What is the etiology of these disorders? Also, students are taking things like ethics and adult intervention, and every other year we offer a class in child intervention. For each of these intervention classes, you're learning evidence-based practice, and specifically you're learning empirically supported treatments like CBT, third wave approaches like ACT or DBT, interpersonal approaches. In child class, you might be learning about family and community interventions as well. Now, all of our students take adult intervention, and those who are interested in working with children and families are required to take child intervention, although other students may take it as an elective. We also have didactic coursework in assessment. That's a 2-course sequence that covers both things like personality and diagnostic assessments, as well as cognitive and achievement assessments. Those happen typically in year 2. And then also starting in year 2 and then in year 3 as well, our students are taking clinical practicum classes. This is working in our clinic, seeing clients. In year 2, the beginning, all students start by seeing adult clients. And then in the spring semester, our folks either switch off into an adult therapy practicum or child and family therapy practicum based off their interest. In year 3, our students start in the fall by doing an assessment practicum with both kids and adults doing full assessments, and then back to either an adult or child-focused therapy practicum in the second semester of year 3. Our students also take as a core clinical course multicultural issues in psychology. We've actually placed this strategically in year 3 so that our students have had some clinical experiences on which to draw, but aren't all the way through the program at that point. Of course, we also try to infuse multicultural issues throughout all of our coursework as well. In addition to this kind of core clinical coursework, our students also take advanced coursework in supervision and consultation. There's the opportunity for specialized coursework as well. So every other year we offer advanced clinical seminars. These have been on topics such as obsessive compulsive disorders and related disorders. Our students right now are enrolled in one that's focusing on trauma. I would imagine with some of our new hires that we may have ones that are focused on suicide or focused on LGBTQ mental health issues. So these are advanced clinical seminars that students can take. In addition, because we're an APA accredited program, we also offer coursework in domain-specific knowledge. So this is the ABCDS that you see here, affective, biological, cognitive, developmental, and social. We actually combine developmental and affective for an emotion development class, given some of the expertise we have in our department. In addition, our students are required to take a 3-course sequence in statistics. The first 2 statistics classes happen in year 1. They cover the general linear model. So the fall semester covers regression, the second semester covers ANOVA and related techniques. And then our students have an option for what they want to do for that 3rd course in statistics. Some of the options include a structural equation modeling class that I teach. There's also an advanced regression class that covers things like multi-level modeling. And we also offer a qualitative and mixed methods class that a lot of our students find useful in increasing their sort of research methods toolbox. Additionally, all of our students are required to take a history and systems experience. We cover that through an independent reading process in a summer that you're here. If you've taken history and systems in undergrad, we can also count that. So this is sort of an overview of our coursework. In future videos, we'll talk a little bit about specific clinical experiences that individuals have, both in our clinic and then out on external practica, what we call traineeships. We'll talk about research opportunities in a video, and then we'll also talk about some of the nuts and bolts of our financial coverage for students. All right, see you in the next video.